As the EBMT Chronic Malignancies Working Party Plasma Cell Disorder Subcommittee, we had a project to analyze patients who received allogeneic stem cell transplant but were on hemodialysis program. And within the EBMT database, which is based on more than 50,000 patients, we were able to find only 6 who actually received allogeneic stem cell transplant while they were on renal replacement therapy. And this is a very rare condition, but it's going to be maybe popular in coming years because this is a new trend. Although allogeneic stem cell transplant for treatment of multiple myeloma is not a well-perceived and well-accepted treatment approach, here in this scenario it's different. In multiple myeloma treatment, renal impairment is an important problem, and it's a poor prognostic feature. It happens and it occurs during the very early phases at diagnosis, and maybe treated completely, and patient may come off renal replacement therapy, but 1 to 2% of patients are kept on renal replacement therapy based on which country the patients are coming and at what stage the diagnosis is made. So patients who have a complete renal failure and who achieve a good anti-myeloma response, they are subjected to autologous stem cell transplant and with very successful outcome, and this has been reported multiple times. However, patients who, after autologous stem cell transplant, who progress, and they might have an option for an allogeneic donor, and some centers who are experienced in allogeneic stem cell transplant may prefer to perform this treatment modality. In the literature, there are only 3 patients earlier who were reported who received allogeneic peripheral stem cell transplant and were treated at the same time with hemodialysis. Here in this database search, we were able to find 6 patients, and out of these 6 patients whose age ranged around 50 to 60, these patients, 2 of them were able to survive more than 10 years. And this is a very important feature, and one of these patients is still alive and who hasn't had a relapse so far yet, and is still on a dialysis program. But what could be an option for such a patient is those 2 patients had a sibling donor and the other one an unrelated matched donor. For a sibling donor, that donor has a potential of a kidney transplant donor as well. And there are again 6 patients who have been reported in 2019 who received sequential both hematopoietic stem cell and kidney transplant. And of these, half of these patients have been very successful. And so for future, with myeloma being better treated and with having better responses, these patients may be subjected to organ transplant, and this will give the benefit of having an immune tolerance and not needing lifetime immunosuppression, as the donor will come with both the immune cells and also with the kidney. This may change the spectrum of myeloma treatment for patients who have advanced renal impairment and who have a potential both organ and a stem cell donor.